Hello, and thanks for joining us today. I'd like to welcome you to this webinar about dental implants. I am Dr. David King. I work currently at Baldwin Family Smiles, and we'll move through the webinar, but basically what I wanted to do is provide some information for any patient or prospective patient, anybody to be honest, and also any dental student, anyone out there who may be interested in, some common dental implant questions. So the subject of the discussion today is dental implants, and I've got some information prepared. Certainly open to hearing feedback and questions. Basically, what I did is I put together a real brief presentation that talks through some common questions that patients ask me and conversation topics that we have as we're discussing dental implants as it relates to replacing teeth and restoring full function. So. We're going to go through a few of these things. Hopefully by the end of this video, this webinar, you'll have a pretty good handle on these basic questions. But if you don't have an answer that you're looking for, please don't hesitate to reach out and let me know. So a little bit about me. I've been practicing dentistry since 2006. That's when I graduated school, but a couple of years in school. So when you add that all together, it's been 20 years of dental practice. I did start as a music major. My patients are always interested in hearing that. Ended up changing my major to business after serving a mission in Taiwan, where I learned to speak Chinese there, that Mandarin Chinese. After that, I worked in Kansas City in the Liberty and Independence area. Was recruited to Albuquerque by a big group. I worked with a big group practice out there, which relocated me to the St. Louis area in 2017, and we've been here ever since. My wife and I have a few acres in Forestell, and she runs a wonderful flower farm, so my evening and weekend job is flower farming, which is an adventure. My wife and I have 5 kiddos. There are some pictures that you see there. My wife, is the light of my life, and my kids are my joy, and I enjoy what I do as a dentist, husband, father, and flower farmer. But husband and father, dentist, flower farmer, in that order. Okay, so here's a picture of our little flower farm from the satellite, and you can see we've got some flower rows. These are 60 feet long, 4 feet wide. We have a few more than what you're seeing here. There are a couple of down here as well, but it's quite the adventure that we have. And here's some of the flowers that we harvested there, daffodils and tulips. So let's talk a little bit about what a dental implant is. So, as we're talking about dental implants, we're basically talking about the whole item that restores a tooth. Now, bear in mind that a tooth or a dental implant can be used for more than just a single tooth. It's essentially a foundation. So this little diagram you see here, here's a tooth on this side, the crown of the tooth, the root of the tooth. Essentially, a dental implant crown is composed of 2 pieces, the crown itself and the abutment, or the prosthetic intermediate component. And then, of course, the dental implant itself. When it comes down to it, a dental implant's really a pretty simple procedure, and we're going to go a little bit through some of that here without getting into the gory, nitty-gritty details. But first of all, let's talk about why dental implants are such a good thing. Dental implants really are the best thing for replacing missing teeth. They have the highest success rate of any of the replacement options in most situations, and they're really going to give you the best solution for replacing a missing tooth if it's an option for you. So here we have a couple of dental implant restorations. These are crowns, and like you saw here, that's that intermediate restorative component plus the crown and the screws that attach into the implants, and I'll show you some of that in a minute. This is a bridge. This is also a bridge, and then these are removable options where we take the teeth out or the teeth are missing, and we put something in that comes in and out, whether it's a full denture or a partial denture, as you see there, the ones with the clasps on them. They come in all sorts of different shapes and sizes, but dental implants really are the best thing for almost everyone in almost every situation because they're fixed, meaning they're attached to the body and they're in the bone, and they give you the most natural, normal function. There are a lot of benefits. They conserve tooth structure. We don't have to compromise or sacrifice the teeth on either side of the teeth like we would for a bridge. They help maintain bone volume. Many people, as they lose teeth, the bone volume will gradually dissipate and you'll see some sunken in cheeks. It's a pretty common side effect of having teeth that are lost. Not only that, but also, as you see here on the lower right, they help to leave the palate open. And these are prosthetics, these are try-ins. You can see there's no palatal coverage there as you would see with a denture like you see here. The palate's not covered with these removable or with these fixed prosthetics like with dental implants. So it's comfortable to chew, you can taste, and the lisping is much reduced. So let's talk about the process of dental implants. Basically, it's 5 steps. The 5th step is the most important step. Well, maybe it's the second most important, the diagnosis and treatment planning to see if you're a good candidate and what kind of an option that's going to be. But the home care, the taking care of things long term, just like after braces or Invisalign, if you don't wear the retainers, things don't stay, they don't remain. So the same thing happens to dental implants. We have got to make sure we care for them. And so that requires some home attention or attention at home to caring for your teeth, your dental implants, whatever the situation may be, whether it's a single tooth like you see here on the lower right, or whether it's a full mouth of implants with a denture that either screws in or snaps in. They have to be maintained and restored and taken care of. Okay, so let's talk about step 1, diagnosis and treatment planning. So essentially, diagnosis and treatment planning allows the clinician, whether it's a general dentist or an oral surgeon or a prosthodontist or whoever it is, to get the big picture of things and figure out what options you have available to you. Now, as we're talking about dental implants, generally what I want to see is what you see here on the lower left, a 3D x-ray, a CBCT image, coupled with an intraoral scan. And this is a scan right here taken with our iTero scanner. There are any number of scanners out there. But that allows us now to generate a working model of the mouth, whether we print it or have a lab print it. Once we've identified the location where the implant's going to go, you can see here, this is where we've planned the implant, then it allows us to fabricate this piece, which is a surgical stent or guide. And this is what makes the dental implant placement process so simple in today's modern dentistry, because it'll allow us to place the implant with no guesswork whatsoever. It's very precise and gives us total control over where the implant goes in a much simpler way. So the diagnosis and treatment planning is gathering data, having a good thorough discussion with the patient about their options. And then for me, what I always tell a patient is, I don't have any vested interest in anything except your long-term oral health. There are many ways to get there. Oftentimes the dental implant's the best way, but there are alternatives, and we're happy to support you if you opt to go a different way. I want to be a resource. So I'm going to provide information, answers, recommendations, and then follow your lead within reason as we move toward oral health. So that's what we're shooting for at the diagnosis and planning appointment. And that allows us again to gather data and prepare for the next steps. So second appointment, and this appointment is oftentimes weeks or maybe a month or more away, depending on the preparation steps that are involved. We'll generate a denture or a surgical stent like you see here. This is actually a prosthetic, a long-term temporary that was made for a patient who was replacing all of their teeth with dental implants. So that was the temporary there. But the surgery and temporary placement is that's the big appointment. That's the one that everyone's afraid of, where we'll actually go in and take the teeth out, smooth the bone, insert the implants or the implant, and prepare for the next steps. So that one requires some preparation. Usually it's at least a couple of weeks, if not a few weeks away. Once in a while, a patient will come in and have a single missing tooth, and we'll be able to place an implant almost immediately at that appointment. But we don't want to rush things for sure. We want to make sure we're prepared and everything is in order so that moving forward, everything goes well. So after the implants are placed, after the surgery, there's a healing time frame. Now, oftentimes, after the implants go in, we'll have an immediate follow-up, meaning 24 to 48 hour follow-up care, whether we're adjusting a denture or adding some soft reline material or some sort of medicament to settle the gums and the bone down a little bit. There's some healing time that has to take place before we move to the next step. So oftentimes that healing time is dependent on the individual patient's clinical situation. So basically, in a nutshell, it comes down to how healthy the bone is and how the procedure goes itself. we like to assume the best. We like to assume that we're going to be able to do just about everything we can at the same appointment. But once in a while, we come across a situation clinically where we can't either attach the dental implants to the prosthetic at the first appointment, or some things don't go as smoothly as we hoped, and so we have to do things incrementally. But this healing time frame allows the body to incorporate the implant or implants. And you can see here, this is a dental implant, this is a prosthetic healing abutment. You can see this dark outline. This is the opening that we had to make in the bone to facilitate placement of that implant. The implants generally, we make the osteotomy or the opening in the bone to accommodate the implant perfectly. However, we don't want to put too much pressure on the bone, so usually we'll end up making the opening slightly wider so that the implant engages just right with the threads and heals appropriately. But that means we have to allow the bone time to heal. And bone doesn't heal nearly as as quickly as tissue, like gum tissue. If you cut your cheek or your lip on the inside, things heal within a few days to a couple of weeks. That's the fastest healing tissue. Bone is the slowest generating tissue because it's so dense and it takes time to regenerate. So we have to allow it time. Now, usually that's on the order of several months. Most of the time, it's 4 to 6 months. Once in a while, we can accelerate that healing time frame to 2 months or so, but most of the time, it's 4 to 6 months, depending on how the procedure went, the surgery went. So the healing time frame is really critical. We don't want to rush it. We don't want to trip over ourselves. We want to make sure that things go appropriately and smoothly so that moving forward, things can happen and work really, really well. Okay, after that, we start restoring the smile. And there are basically 3 types of dental implant restorations, and I'm going to show you some models here in a second. What you're seeing here is the single tooth dental implant restoration. It's an implant, an abutment, and a crown. So that process involves a scan or an impression. We have a scan here and an impression there, which allows us now to generate the implant prosthetics. And again, these are specific to each individual patient's need. The prosthetics are made uniquely to each person, and you can see how customized these are to match the gum tissue and, of course, the height of the implant. But these 2 implant crowns are actually these 2 teeth. So it's this one and this one. These 2 are these 2 in place. So if we do our job right, when the implants are placed in the right place, guided with surgically guided, and then the restorations are designed appropriately, you can have a very, very nice outcome. There are basically 2 types of implant single tooth restorations, and we're just going high level here. We're not going to dig into the details. But you have a screw retained, which is what these 2 are, where there's a screw that goes all the way through it. You can see it coming through here that attaches it to the implant, or there's a cement retained. Now the distinction you can see here. There's a line right there that connects this crown, which is cemented, onto the abutment. So that's a cement retained. This is screw retained. They're essentially equivalent. It depends on the need, the location in the mouth. Usually the front teeth will end up being cemented. The posterior teeth will end up being screw retained. But ultimately what we're looking for is the best outcome for that particular clinical situation. So impressions or scan, and then a couple to a few weeks later, we'll get a prosthetic back from the lab, and then we place that and follow up, usually in a couple of weeks, to make sure everything fits and feels okay. All right, so the second type of implant restoration is some sort of a prosthetic that snaps into place. So let me show you one option here. And what you can see down here are the same things that I have here. This is a clear jaw model. And you can see there's a couple of dental implants there. And we've got a denture with 2 attachments, 2 precision attachments that have little nylon locator attachments. And so these guys are oriented and they snap in place. And that allows it to hold nice and tightly. Now you will notice this type of a restoration, there's some movement at the back. Right here, you can see that, because there are only 2 implants in the front holding it. So there's a line of rotation in the front. On the other hand, the other type of prosthetic, where we put in 3 or 4 implants, there is no movement. It won't move because you've got kind of like 4 table legs It's nice and stable. So in this situation, you'll get a much better outcome. And the little gasket attachments come in different shapes and sizes, but in the end, what we have in this particular type of prosthetic is a conventional denture, upper or lower, that snaps in to a series of dental implants in a certain way. And this can be done in several different ways. So this is the removable type of prosthetic that you see here. There's a scan, as you can see here, or an impression. It goes to the lab. There are a couple of steps. They incorporate these snap caps into the denture, and then you come back in and we deliver a denture and you snap it in and you go eat corn on the cob and apples. No problem. Now, some of us are comfortable doing this step in the office. It's really not too difficult. There are some processes there that can be done in one appointment, but a lot of us still send it to the lab. So it just depends on what the specific clinical situation is. So those are the removable type of prosthetics. So we've talked about the individual tooth, the removable prosthetics, and now we'll talk about the fixed prosthetics. So these are the type of implant dentures or bridges that cannot be taken out by the patient. You can see here there are 4 little holes, and down in those holes are little screws. Now if I had the screwdriver, the finger driver, I would be able to unscrew them and show you exactly what it looks like, but in a nutshell, you can see through the acrylic there. You can see the implants. So this is a permanent solution. The old guidance used to be that we would place the screw-retained denture, like you see here, and we'd recover it about once every 2 or 3 years. We'd change out the itty-bitty little screws and put it back in after it was cleaned. But now we've learned, generally, that we're better off leaving those alone, because what happens is it creates some wear and tear on the parts as you take them in and out. So as long as you're coming in for follow-up care and checkups, these prosthetics, if you go this way, generally speaking, never need to come out unless there's a problem. And so we can do that on the upper and the lower. And however many implants are necessary is based on the clinical situation for each individual patient. So that process essentially is the same. This one's a little bit more complicated because of the complexity of the restoration. But basically what we do is we do a scan or a series of scans and a set of impressions. There's a try-in appointment, there's another try-in appointment, there's a couple of other appointments, and then we deliver the prosthetic. And they can be made out of any number of things. So like you see here on the lower right, this is a zirconia prosthetic with built-in titanium abutments. This is an acrylic prosthetic with a strengthening bar there. There are benefits and drawbacks to each one, but generally most of the restorations are made now with zirconia, because it's much stronger and can have a very lifelike appearance, like you can see there. So, restoring your smile, that's the 4th step. Now the 5th step, like we talked about, really is the super critical, important step. This is the step that you have to maintain, just like your natural teeth. You know, if you're coming in for replacement of all of your teeth, chances are something didn't go right, which dictates the need to take your teeth out and replace them. So we don't want to replicate that with dental implants. Even though dental implants have a very high success rate, the dental implants can never outrun bad habits. You know, we all have those less than ideal habits when it comes to taking care of our teeth. So we have to make sure that if we've invested time and money, you as a patient have invested time and money, we want to make sure that we're doing what we should be to take care of things so that everything stays healthy. Okay, so let me just run you back through, recap the options that we normally do with dental implants. So here we have a little model, and you can see this front tooth has been restored with a dental implant. Right there in the front is a dental implant and an abutment. The abutment is sticking up through the clear gum tissue, and the crown itself, this is a cement retained restoration, is cemented in place. So that's a single tooth implant. Now those can be in front teeth or back teeth. They can also be used to replace multiple teeth, like a bridge. You can see there are 2 implants with 2 abutments there coming up through the gums, and a bridge, just like a single crown. This is multiple connected crowns that are glued or cemented in place. So that's also an option. The removable option, Like we mentioned, generally the best outcome is 4 dental implants, or at least 3, so that you get a nice, table leg or stool with multiple legs foundation so that it doesn't rock. Now you can pull it out and we can change the retention on these gaskets so they're tighter or looser depending on the individual. A lot of times if we get patients who are very, very aged, they have difficulty getting them out, so we have to make them less retentive. But most of us want them nice and snug. The other variation of that is to have just a couple of implants. And this is a good choice. It's much more cost effective. However, in the end, you'll have less retention as the back of that denture will move a little bit up and down. So we always recommend more implants if possible. And then of course the Cadillac option is the screwed in set of teeth that you never take out. You still come in every 6 months to have the dentist or the dental hygienist clean, but these never come out. And generally speaking, if we do this process, if possible, if the procedure goes well, we can actually attach the dental implants to the temporary denture and you leave with a fixed, meaning attached set of teeth. So, but aftercare again is the most important piece. Okay, so there are a lot of questions here. I'll leave the data that's up on the screen to let you look through. We only have a few more minutes left here. Won't take too much longer. So like I mentioned before, yes, you can replace one tooth with one implant, but if you have multiple teeth, one tooth, one implant, multiple teeth that need to be replaced, you don't necessarily need one implant per tooth. In this situation, we have 3 teeth with 2 implants. In this situation, we have 12 teeth with 4 implants, or 5 or 6. This one is 5 implants for 12 teeth. Here you have 12 teeth, 4 implants with removable prosthetic, and then of course 2 implants, removable prosthetic, 12 teeth. So there are lots of options there based on what you're interested in doing, or 14 teeth on those lower. Sorry, can't count. I'm a dentist, not a mathematician. And ultimately it comes down to what you need and what works for each individual clinical situation. So like I mentioned earlier in the video, sometimes we don't know what we're getting into from the standpoint of how dense the bone is, how healthy the patient's jaw is. We like to hope that we can attach them if we're doing something like this. We like to hope that we can attach them at the same appointment, but oftentimes we can't. So I usually like to under-promise but over-deliver if possible. So we'll attempt to attach it if we can, but I don't want to say to the patient, we guarantee blah, blah, blah. We always want to do our best to be very, we want to under-promise but over-perform, over-deliver. Okay, what can I expect? So if we do something like this, and we take out all the teeth and we deliver some implants, and we're planning on eventually down the road at 6 months or so getting to a screwed-in set of teeth, I will always make sure my patients have a denture. So they'll always leave with at least a denture, upper and lower, if we take out their teeth, so they don't have to walk around with no teeth. But usually if we've taken out all the teeth and made an immediate denture, just like with an immediate denture in any situation, things won't fit and feel perfect. You'll need to wear some adhesive and it'll take some time for things to recover. So you want to be careful there, but that's very, very common to leave the dental office if you're doing a full set of implants with just a denture, depending on how the procedure goes. How much do things cost? So I'm going to give you some ballparks, and I want to throw a disclaimer out there. This is before any insurance and any discounts. This is what we would call a UCR, a usual, customary, and reasonable fee. If you look out across the dental industry, about the 70 or 80th percentile, meaning 70% of dentists are at or below this level, for a single tooth implant, a single tooth. That's this front tooth, single tooth implant with the implant, the abutment, and the cemented crown is between $4,500 and $5,000 before insurance and any discounts for a single tooth. So round up about $5,000. Now the insurance may dictate a lower fee, and they may pay a portion of that. So the chances are really, really good you wouldn't be expected to pay that entire fee, and the insurance may help you out quite a bit. On the other hand, it may be something that you don't have any insurance benefits. A lot of the insurance plans that are out there aren't necessarily the best plans, and so we have to be cautious with what we promise to our patients regarding insurance benefits. The other thing to bear in mind is the implants themselves. That process doesn't happen all at one appointment. It's spread out over time. So the first appointment is the consult and the diagnosis, where we order the surgical stent. There's a little bit of a fee there. After that is the surgical appointment. We take the tooth out, we place a bone graft, maybe a membrane, and then the implant oftentimes. And then there's several months of healing and waiting time. After that, we place the abutment in the crown, and oftentimes we won't collect for the crown until it's seated. So usually the cost, whatever the cost may be, depending on your insurance plan and benefits available to you, could be several months or a year or more. The middle of the road option, this denture that's retained by implants, essentially what we're talking about is the cost of taking out a tooth, which could vary from $100 to $200 or $300 per tooth, depending on your insurance, to potentially, the cost of taking out a tooth, the cost of the denture is about $1,600 or $1,700, again, before insurance and discounts. And then each implant interface, these abutments, the implant and what's called the precision attachment cap, it's about $2,000 per unit. So to give you a ballpark figure, if you're talking about 10 teeth on the bottom that need to come out, that's about $2,000 worth of surgery, give or take here or there. If you want to be sedated by an oral surgeon, there's a cost for that. The denture itself is $1,600 or $1,700, plus the cost of 2 dental implants, $2,000 each, $4,000. So that'll give you kind of a ballpark to figure out what that is. And essentially it's the same on the top, except on the top we always recommend at least 4 implants as opposed to 2. And you can do the extrapolation going from 2 implants to 4. Again, these are all ballpark estimates depending on your insurance and what your insurance may pay or may not pay. Now the Cadillac option, the best choice, the fixed set of teeth, the one that never comes out after it goes in, is quite a bit more expensive. Essentially, you're talking about $30,000 per arch. That includes the implants of the prosthetic. And the reason why there's such a price difference is because of this prosthetic and some of the procedures that go into attaching the temporary denture. One of the unique things that happens to a dentist or a surgeon and a patient when we go through something like this is they spend a lot of time together. And so it becomes something where I had a dentist tell me, he's an oral surgeon, did a lot of big cases like this. He said, when you do a case like this, you have to assume that you're married to the patient now. So there's a cost to being married to a patient because there's some follow-up care. But this prosthetic is a very expensive prosthetic, not only for the patient, but for the dentist and for the lab. It takes a lot of work to make one of these and to make one well. So we want to make sure that you get a high-quality prosthetic long-term. So those are pretty expensive, $30,000 or so per arch. So more than twice that if we're doing the full mouth. But it's very doable. And I've done this many, many times. In the end, yes, there's a bullet to bite, if you will. But down the road, the restoration is worth it. It's worth it. Okay. So, am I a good candidate? Really, this is a question that you need to sit down with your provider, your clinician, take an x-ray, do an evaluation, and talk about the options to determine if you're a good candidate. Sometimes there's a medical consult that's needed depending on your health history, but that's a really variable question. What sort of care is needed to look after? Well, good home care, brushing and flossing. Yes, flossing under a denture, flossing around your implants is really critical. I always try to describe it as like when a patient, when you get out of a swimming pool and you're drying your back, you flap that towel around and rub your back to dry it off. It's the same idea around dental implants. You want to kind of scrub around the implants with what we call super floss. It's a very thick floss that helps to clean off the plaque. And the plaque can cause bacterial infections and cause bone loss and all sorts of other issues. So you have to maintain them, coupled with a 6-month checkup, just like you would for everything else, every other dental care. Okay, that's it. That's all I've got. Hopefully this has been helpful. I've gotten a lot of experience placing and restoring and fixing and removing dental implants. And generally speaking, the best thing you can possibly do is get a big picture as far as what the whole process entails. Make sure you develop a trust in your provider, have a good relationship. It never hurts to get a second or a third opinion. Oftentimes the second or third opinion is someone you might feel more comfortable with. However, I'm not advocating for leaving your current dentist. This process is pretty involved, and you want to make sure you have find someone that has experience doing this, not only just doing it, but dealing with some of the consequences or challenges that come down the road. But honestly, dental implants are the best restoration out there when it comes to replacing a missing tooth. It's not always the best option for everyone, but it is almost always the best option for almost every clinical situation. So it's worthwhile, if you're interested, having a consult with your dentist or oral surgeon to see if you're a good candidate and determine what options are available to you. So this is where I practice right now, Baldwin Family Smiles. That's me right here. This is Dave King, DDS, signing off. Thank you very much for spending the last little bit with us.